Hello, for our controversy presentation, we chose Psychedelics are a better treatment for mental illnesses than regular medications by Hannah, Bella, Ryan, Brenna, and Neel. So starting off, what is mental illness? Mental illnesses are health conditions involving changes in emotion, thinking, or behavior. Mental illnesses can be associated with distress and or problems functioning in social, work, or family activities. Mental health is a foundation for emotions, thinking, communication, learning, resilience, hope, and self-esteem. It also is a key component to relationships, personal and emotional well-being. Mental illness does not discriminate at all. It can affect anybody regardless of their age, gender, geography, income, social status, race, ethnicity, religion, spirituality, sexual orientation, background, or any other aspect of cultural identity. While mental illness can occur at any age throughout your life, 3/4 of all mental illness cases begin at the age of 24. Moving on to the next slide, non-psychedelic treatments. Diagnosing a mental disorder doesn't automatically necessitate for a medical intervention. The decision to treat it is based on factors such as symptom severity, their effects on daily activities, and the advantage and disadvantages of available treatments among their considerations. Mental health care relies on a tailored plan created in partnership with a mental health professional. This plan might encompass psychotherapy, commonly known as talk therapy, medications, or other forms of treatment. Frequently, a blend of therapy and medications prove to be adequate, but the use of complementary and alternative treatments is on the high rise. Also, along the lines with that, self-help and support can be very important to an individual's coping, recovery, and well-being. Lifestyle changes such as good nutrition, exercise, and adequate sleep can support mental health and recovery. Primary care clinicians, psychiatrists, and other mental health clinicians help individuals and families understand mental illnesses and what they can do to control or cope with symptoms in order to help improve health, wellness, and function. Moving on to the next slide, potential negative effects. Modern psychological therapies can have adverse impacts such as aggravating current symptoms, the formation of new psychological challenges, and low self-esteem and strained relationships. For example, demanding treatment can explicit suppressed memories, causing additional discomfort, or certain mental health medications may induce negative side effects such as weight gain, result in a poor self-image. Furthermore, addressing personal matters in therapy may change how people view themselves or in life, perhaps leading to feelings of vulnerability or existential dread. The complexities of psychological interventions, such as how they might not always align with the individual's unique needs, potentially leading to a more negative outcome like increased anxiety or depression or dependency on therapy. It might also delve into the ethical considerations and the importance of informed consent, where patients must be fully aware of the potential risk and benefits of treatment. This understanding is crucial and critical for practitioners to refine their approaches and their ways for their patients to keep them more informed about their decisions and about their mental health care. Next slide, psychedelic treatments. Over the next few slides, we're going to be going over the psychedelic treatments, which encompass LSD, kava, psilocybin, and ketamine.
Lysergic acid diethylamide, otherwise known as LSD, is a potent psychedelic. It is a synthetic chemical made from a substance found in ergot, which is a fungus that infects rye. In its purest form, LSD is a white, odorless, crystalline substance. The most common form to take LSD is drops of the solution dried onto gelatin sheets, which are meant to dissolve under the tongue. Other forms include liquid, tablets, or capsules. In low doses, LSD can cause intensified thoughts, emotions, and perception, as well as quick breathing, increased body temperature, and a fast heartbeat. In high doses, LSD can cause mental, visual, and auditory hallucinations, as well as paranoia and psychosis. In small doses, LSD can help mental illnesses such as anxiety, depression, and PTSD. LSD binds the 5-HT2A serotonin receptor, resulting in a sense of euphoria. The receptor closes a lid over the LSD molecule, preventing it from quickly leaving, creating longer-lasting effects. LSD can also aid in therapy, allowing individuals to discuss traumatic events without high levels of anxiety or fear. LSD shows the most promising results in the realm of social anxiety. In a study using mice, researchers found that LSD increases social interaction in mutant mice that display behavioral deficits. This is because of the fact that LSD binds the 5-HT2A receptors, which in turn activates the AMPA receptor, as well as the protein complex mTORC1. Ultimately, this reaction results in increased empathy and social behaviors. Although LSD can aid with mental illness, it also has some potential negative side effects. Due to the unpredictable nature of the drug, its effects vary per person. In some cases, individuals can experience what is commonly called a bad trip, in which they experience negative thoughts, emotions, and in severe cases, hallucinations. These are common in instances where the individual takes a large amount. In addition to that, while LSD is not considered an addictive substance, some individuals can become addicted to the experiences they have while under the influence. This can lead to detrimental effects further down the line. LSD can also worsen mental illnesses such as schizophrenia or psychosis.
So now we're moving on to talk about kava. So what is kava? Kava is a depressant that is made from the root or stump of the kava shrub. Kava is most commonly ingested in a drink form as a tea. The tea kind of looks like this dark liquid. It's pictured in the bottom right of the slide. Kava affects the brain and other parts of the central nervous system. So what does kava do? When taken in small doses, kava can induce muscle relaxation, sleepiness, general feelings of well-being, and it's been used in stressful events to calm the nerves and even reduce the chances of conflict. It can even make people more sociable. But when taken in large doses, kava can induce intense feelings of euphoria and extreme drowsiness. So how can kava help? It can mostly help anxiety and insomnia disorders. Kava can be used as a treatment for anxiety by increasing the dopamine in the brain. It makes the brain more sensitive to the GABA receptors, reducing this non-adrenaline level, leading to the overall calm sensation. Kava can also help with insomnia. Because kava affects the nervous system, it induces this feeling of drowsiness. And it can be used to elevate one's mood. When interacting with the GABA receptors, kava can help regulate one's mood, leading to this general feeling of well-being. There has also been animal studies showing that kava can stop bladder tumor growth in animals, so it could be used for cancer. So potential negative effects of kava. There have been some deaths linked with kava use, so at one point it was banned. In addition, there's a potential liver and kidney damage if kava is taken long term. Kava can also result in weight loss because it gives someone a loss of appetite. In addition, kava can create a loss of drive and motivation in the long run, which is why I didn't list it as being used to help with depression. Kava can also worsen the symptoms of pre-existing mental illnesses such as schizophrenia. And when taking kava, it can be used for anxiety, but it's not a long-term treatment for anxiety because of all of these negative effects.
Psilocybin is a psychoactive chemical molecule found naturally in more than 100 species of mushrooms around the world. These so-called magic mushrooms are most commonly ingested by eating or drinking in an infused tea. The experience that comes from using magic mushrooms or other psychedelic drugs is known as tripping. After being ingested, the body breaks down the psilocybin into its active form called psilocin and makes its way into the brain. One trait of psilocin is its chemical structure's similarity to serotonin, a neurotransmitter that is naturally produced in the body. Here you can see the chemical structures of psilocybin, psilocin, and serotonin. And as you can see, they look pretty similar. Serotonin plays many roles in your body, including influencing learning, memory, and mood. It's often called the body's natural feel-good chemical, as normal levels of serotonin tend to make you feel happier, calmer, and more emotionally stable. Serotonin also regulates body temperature, sleep, sexual behavior, and hunger. It is worth mentioning that a lack of serotonin is thought to be a contributor to mental illnesses like depression and anxiety. Because of psilocin's chemical similarity to serotonin, it is able to bind specific serotonin receptors called 5-HT2A receptors. When psilocin bonds to serotonin receptors, it creates new neural connections and allows different sections of the brain to communicate with each other. Depression is correlated with the atrophy or loss of neural connections in the limbic and cortical regions of the brain, which control mood and emotion. The neural connections that are created by psilocybin are what make professionals believe that it can be a real help for improving depression symptoms. Some experts describe a mushroom trip as a condensed version of talk therapy, except with yourself as the therapist. The benefits include the possibility of gaining new insight on old problems and an overall sense of understanding life. Psilocin also affects the part of the brain responsible for the ego, and it can dissolve one's ego, giving a feeling of being connected to the world. As a clinical practice, patients are given low doses of psilocybin under the watch of a therapist. Studies on psilocybin have been conducted since the 1940s, but the idea has gained much attention recently. A recent study from Johns Hopkins showed that treatment with psilocybin relieved major depression symptoms for patients and lasted for up to a month after the treatment was given. While the research of the benefits of psilocybin as a treatment for mental illness is still ongoing, the research so far shows promising results for the future of psychedelic treatments.
Ketamine is a common drug that has been used for decades in both medical and recreational settings. Until recently, the medical use of ketamine has been limited to anesthesia due to its quick-acting dissociative effects. The most frequent use is in people with treatment-resistant depression, where they have tried endless routes of therapies and medications without improvement. Although, following treatment with ketamine, it has been reported that users experience a reduction in depressive feelings, suggesting its potential benefits. In a medical setting, ketamine is administered intravenously to reduce the likelihood of the drug being abused. Unfortunately, its growing popularity among communities such as festival goers has led to the development of more variations of ketamine, including oral tablets and snorting a powdered form. Despite the long-term effects of ketamine not being fully understood, it's gained a significant amount of popularity in recent years, with people reporting a variety of effects from person to person. So, looking at the chemical structure of ketamine and its interactions with the brain, the compound substitutes two hydrogens with a chlorophenyl group and the other with a methylamino group. This substitution allows for ketamine to produce its antidepressant effects, and the first interaction we see with ketamine is the inhibition of NMDA receptors, which are essential glutamate receptors. These contribute to memory formation, suggesting that their inhibition may be useful in treating mental illness. Blocking the activity of NMDA receptors also increases the expression of brain-derived neurotrophic factor, BDNF. BDNF are proteins that regulate neuronal growth and survival, and the antidepressant effects associated with ketamine arise through a downstream signaling process which is triggered by an increase in BDNF in the hippocampus. Another study using mice found that no antidepressant effects of ketamine were induced when there was a deletion of BDNF. A third mechanism involved is the anterior cingulate cortex, or the ACC. Activity of this region is significantly increased in individuals with major depressive disorder. When ketamine is administered, the activity of ACC is partially decreased for a period of hours to days, which may be due to the blockade on NMDA receptors. And so, together these mechanisms contribute to the decline in symptoms for those with major depression and other mental illnesses. Now, looking at some of the positive effects, research has reported an overall increase in mood after low-dose treatments with ketamine. For individuals with major depression, a handful experience treatment resistance. Patients who have undergone ketamine treatment reported an improved mood and ability within days. Consistently using the drug in a controlled environment can lead to improvements, although further research is needed to understand the long-term effects that may occur. Frequently associated with MDD are suicidal tendencies and ideations, which have also been reported to decline in individuals when using ketamine for its anesthetic purposes while undergoing electroconvulsive therapies. A third benefit of ketamine has been shown in some people struggling with substance use disorder. When attempting to treat alcoholism, ketamine can be used to minimize cravings of alcohol associated with dopamine, which increases the duration of time to relapse and the chances of abstinence. A final, less explored use of ketamine is treatment for PTSD. A small amount of research suggests that ketamine may reduce avoidant behaviors and overarousal. Despite the benefits of ketamine, our limited knowledge on the long-term effects of the drug prevent it from becoming a medically approved treatment for depression. Ketamine is still an incredibly strong drug that often leaves people feeling very disconnected and sometimes like they are not in their own body. In a few cases following treatment, patients have reported worsened or new tinnitus, which is a consistent ringing or buzzing in your ears. Ketamine treatment can also induce states of mania, which can be very dangerous for someone suffering of severe mental illness. The long-term effects of ketamine may also have patients feeling very dependent on the drug in order to achieve the initial happy feelings they get in the beginning of treatments. Overall, the use of ketamine as a treatment for mental illness is a growing field of study that requires more research to fully understand.